Welcome back to the deep dive. We're here to take some pretty dense material, cut through all the noise, and give you the shortcuts you need to be, well, the most informed person in the room.
Today we are on, I think, a really interesting mission. It touches on anatomy, physics, even global economics. We're doing a deep dive into infraorbital dark circles.
Right, the dreaded under-eye circles. And we're basing this on a really comprehensive review that looks at everything, the causes, how to evaluate them, and what treatments actually work.
And our goal here is to get way beyond the usual advice, just get more sleep.
Yeah, that old myth. We want to uncover the specific multi-layered causes. I mean, everything from your actual bone structure to these tiny pigment changes in the skin.
And then from there, map out the whole spectrum of solutions that are tailored to those specific factors.
Yeah.
Because it is a huge topic.
It really is. The aesthetic impact is, well, it's profound. Our perception of how tired or old someone looks is so often based on that area right around the eyes.
For sure. Dark circles just signal tiredness or age or even sadness, really.
And the money people spend trying to fix it tells the whole story. I saw this stat. The average woman in the U.S. spends around $15,000 in her lifetime on makeup and cosmeceuticals.
15,000. Wow.
And a huge chunk of that, a really big percentage, goes specifically to under-eye concealers.
And that's just the camouflage. That spending is driving a massive industry, but it just explodes when you move past makeup and into, clinical procedures.
Oh, absolutely. The data we pulled is pretty startling. Just a few years back, over $12.5 billion was spent on cosmetic procedures in the U.S. alone.
And that number keeps going up. People aren't just covering the circles anymore. They're trying to correct them surgically.
We saw that eyelid surgery was the third most common surgical procedure overall. We're talking hundreds of thousands of procedures every year.
And soft tissue fillers, which are often used to fix that hollowness under the eye, that was the second most common minimally invasive procedure. Over 2 million procedures.
The amount of resources going into solving this one perceived flaw is it's a huge signal of how deeply it affects people.
Okay, so let's get into it. Let's unpack the science behind why this happens. The deep roots of dark circles.
And the source material makes it clear right away. This isn't one thing. It's a complex, multifactorial challenge.
Yes. It's deep facial anatomy, it's soft tissue, it's the skin itself, all interacting at the same time. You have to start with the foundation, with the anatomy.
So where do we begin? The bone.
We have to. Because a lot of dark circles aren't actually dark pigment, they're shadows. As we age, the bone of the orbital rim starts to recede. We lose bone volume in the midface.
So the skull, the bone itself, is literally pulling back and shrinking a little bit.
That's right. And you have these things called retaining ligaments, which are like tough little ropes holding things in place. As the bone shrinks, the ligaments don't loosen up.
They stay put.
They stay put and they get tighter. And that causes this tethering, this hollowing, especially in that little corner near your nose, the tear trough area.
And that valley, that hollow, is what creates the shadow.
Precisely. And this is where lighting becomes so important. Our source material points out that overhead lighting makes these shadows look way worse.
Right, but if you have direct front-facing light, like from a ring light for a selfie, it can almost make them disappear entirely.
It's a trick of light caused by these fixed anatomical valleys. But, okay, moving up from the bone, you then have issues in the soft tissue.
Which is the skin.
The skin, and what's right underneath. And the lower eyelid skin is one of the thinnest, most transparent parts of the entire body.
It's basically see-through.
Exactly. Because it's so thin, there's very little fat underneath it to provide any camouflage. So the underlying vascular network, all your tiny blood vessels, and the orbicularis oculi muscle, they show right through.
And that's what gives it that bluish or purplish look. You're not seeing skin color, you're seeing what's underneath.
You're seeing muscle and venous congestion right through the skin,
Okay, that makes sense. But then you get into fluid and actual pigment issues, which just adds another layer of complexity.
Absolutely. Fluid accumulation, what doctors call edema, is a major contributor. That's the puffiness that makes circles look worse in the morning.
Or after a really salty meal.
Yes, that late-night pizza effect. That fluid gets trapped right under that thin skin, and it makes the puffiness and the shadowing even more prominent.
It really shows you how dynamic your appearance could be just from one day to the next.
And that fluid often takes on a purplish color because of that muscle showing through. But then you have true pigmentation, which is a whole different problem. This is often caused by the extravasation of hemoglobin breakdown products.
Okay, let's stop on that word, extravasation. For the listener, what does that mean in simple terms?
It just means blood is leaking out
Hmm.
very, very slowly. Red blood cells leak out of the tiny vessels and their hemoglobin breaks down into other compounds.
Like what?
Specifically, things called hemosiderin and biliverdin. Hemosiderin has iron in it, so it leaves a brownish stain. Biliverdin is greenish. These are basically the colors of an old bruise.
So you get these fixed, long-term stains under the skin from old blood products.
That's right. So now we've got shadows from bone, a blue or purple tint from visible vessels and muscle, and now brown and green stains from pigment.
That's already 3 totally different problems.
And we're not done. The skin quality itself is a factor. Besides being thin, you can get acquired hyperpigmentation, which is just excess melanin.
From the sun, mostly.
UV exposure is the biggest one, for
Yeah.
sure. But also hormonal changes, inflammation from allergies, even some medications like oral contraceptives can trigger it.
The most fascinating thing I read was this study on Japanese patients. They had confirmed pigment changes, like it was physically there, but they still said their circles looked darker or lighter day to day.
Yes, that finding is so important. The theory is that even when the pigment is fixed, that daily edema, the puffiness, can actually enhance how light reflects off of it. It basically magnifies the appearance of the pigment that's already there.
Which just reinforces that central idea. The problem is always dynamic and it's always multifactorial.
And that's the perfect setup to start talking about solutions. Because if the problem has many layers, the solutions have to as well.
Let's start on the surface then with concealment and targeted chemistry.
The very first step in any kind of management strategy, and this is the biggest shortcut, is getting the right diagnosis. You have to know what you're treating. Is it shadow? Is it pigment? Is it fluid?
Because you need customized therapy.
You have to. So let's start with the least invasive thing, makeup. Even basic concealment relies on color theory. You use the color wheel.
Right. Opposite hues cancel each other out. If the circles are reddish, you'd use a green tinted concealer.
And if they're more purplish or blue, which is common from the vascularity, you'd use a yellow or orange-toned base.
But the real innovation here is in something called optical diffusers.
Yes, this is really cool science. These are compounds like mica or titanium dioxide. They're made of these tiny microionized mineral particles of different sizes. They don't just cover color, they actually manipulate light.
How do they do that?
The larger particles will sort of fill in the tiny valleys in your skin, and the smaller ones sit on top of the peaks. And because they have different refractive indices, they just scatter light away from the skin, creating this illusion of a perfectly smooth, bright surface. It's a physics trick.
So it's not hiding the darkness, it's just making it so light doesn't go in there.
Exactly. Now, if we move into chemistry, cosmeceuticals, we have to start with retinoids.
Vitamin A derivatives.
Yep. And they're foundational because they work on multiple problems at once. They boost collagen synthesis, which thickens the skin, making it less transparent.
And they also directly reduce melanin content.
They do. So you get smoother skin and less discoloration. It hits both issues.
Okay, next up is the, I guess, the controversial workhorse of pigment blocking, hydroquinone.
It is a bit controversial, but it's effective. It basically works by blocking an enzyme called tyrosinase. It shuts down the assembly line that makes pigment. Low concentrations, 2 to 6%, are usually enough.
So what's the controversy?
Well, it's a regulatory issue. Hydroquinone is actually unavailable over the counter in parts of Europe and Asia because of some concerns about carcinogenesis.
Cancer concerns.
It's important to have context, though. The concern mostly comes from a study where rodents were fed large amounts of oral hydroquinone. That's a world away from applying a tiny bit topically to your skin, but the regulation is what it is.
So if you can't get it, what are the alternatives?
There are some great botanical options. Arbutin is one, or kojic acid, which comes from mushrooms. They block that same tyrosinase pathway just through a different chemical route.
And what if the main issue is that vascularity, the puffiness and leakage we talked about earlier?
Then you want to look for topical caffeine. Caffeine is a vasoconstrictor, which means it tightens up the blood vessels. That reduces the puffiness and the leakage. There was a study that showed a caffeine gel worked really well for diminishing both edema and the pigmentation that comes with it.
Okay, and finally, peptides. They are everywhere in skincare now.
They are, and they sound complex, but they're just short chains of amino acids, building blocks of protein. They're basically little messengers.
And they do different things, right?
Exactly. You have signal peptides that basically tell your skin, hey, make more collagen. Then you have enzyme inhibitor peptides, which protect the collagen you already have, and carrier peptides, which deliver things like copper that are needed for skin repair.
Okay, so that covers what you can do at home. Let's get into the clinical stuff. Technical resurfacing and volume correction.
This is where you're seeing a specialist for energy-based treatments, starting with intense pulsed light, or IPL. This uses a broad wavelength of light, and the key here is that the light is absorbed by specific targets in the skin.
Those are called chromophores, right?
Yeah.
In this case, hemoglobin in the blood and melanin pigment.
Right, and when those targets absorb the light, it creates heat. That's called selective photothermolysis.
Selectively using heat from light to destroy a target.
You got it. The heat damages the pigment or the vessel, and the body just clears it away. It's great for lighter skin types.
Now, if you have darker skin or you need to go deeper, you might use radiofrequency or RF.
Yeah, RF is different because it uses electric current, not light. So it bypasses the surface pigment entirely, which makes it much safer for a wider range of skin types.
And it goes deeper.
It does. It heats the dermis deep down, causing collagen to contract immediately, and then stimulating new collagen growth over time. The results are usually described as mild to moderate, but the safety is excellent.
What if the problem is purely pigment, though?
Then you go for Q-switched lasers. These use these ultra-short nanosecond pulses of light to literally shatter the pigment clusters. The key takeaway is just that the type of laser has to be matched to your skin tone for safety.
And if the source is confirmed to be vascular?
Pulsed dye lasers. They use a wavelength that's specifically absorbed by the red pigment in blood, so they shrink the vessels without hurting the surrounding skin.
Okay, we also have chemical peels.
Right. Peels are great for pigment issues and for fine lines. They basically work by exfoliating and removing that excess surface melanin. TCA peels are very effective. One study showed over 90% improvement with a combination of TCA and lactic acid.
But you have to be careful with those, especially on more pigmented skin.
Absolutely. Diagnosis first, always. And then finally, before surgery, we have the fix for the shadows. Hyaluronic acid fillers.
These have become a go-to treatment.
They really have. They're easy to use, and they can be reversed if needed. They work by fixing that underlying volume deficiency that causes the shadows in the first place.
You're just filling in the valley?
You're filling in the specific hollows. By adding volume back, you smooth the contour and the shadow just disappears. It's a structural fix for a structural problem.
Which brings us to our final segment, the deepest structural fixes, when you need more than just filler.
Right. When you need a more permanent or comprehensive volume solution, you look at autologous fat transfer.
Taking your own fat from somewhere else and moving it.
Exactly. It's injected deep along the infraorbital rim. Because it's your own biological material, it integrates really well, smooths that whole eyelid cheek area, and patient satisfaction is very high.
But if the anatomy itself needs to be physically adjusted, then we're talking about surgery. Lower eyelid blepharoplasty.
This is the surgical solution for shadowing. And it comes in a few different forms. If the problem is bulging fat pockets, a surgeon can do a simple transconjunctival fat excision.
Cutting from inside the eyelid.
Right. No visible scar. They just remove that little excess bulge of fat and the shadow it was casting is gone.
But sometimes you don't want to remove the fat, you want to reposition it.
And that is a more advanced technique called a transposition blepharoplasty. The surgeon releases that retaining ligament we talked about earlier and then moves a patient's own fat down into the hollow. They're using existing tissue to fill the valley.
And what about for people whose bone structure is the main problem? I think the term was negative vector anatomy.
A negative vector just means the eyeball sits a bit forward relative to the cheekbone, so there's not enough support underneath. For those patients, tear trough and cheek implants can be used to build out that underlying bone structure.
It provides the projection you need to create a flat, shadow-free surface.
Exactly.
You know, what's so extraordinary about all this is how perfectly it shows why customized medicine is so important. We started out talking about people spending thousands on concealers, on quick fixes.
Right.
But the truth is, dark circles are never just one thing. They're this combination of factors from the deep skeleton all the way to the superficial skin.
That's the central finding. They are always multifactorial. You need a targeted therapy that addresses the specific skeletal, soft tissue, pigment, and vascular issues present in your unique face.
There is a solution for every single component, but you have to know which one you're treating.
You do.
So let's leave you with a final thought to think about. We talked about how the appearance of dark circles can change day to day, tied to things like fluid retention or even just the angle of the light.
Mm-hmm.
So if that's true, If your apparent level of fatigue and age is constantly shifting based on these subtle variables,
Huh.
what does that tell you about how much your environment, your diet, your sleep, your light exposure interacts with your fixed anatomy to determine how you look?
That interaction between the structures you were born with and the daily habits you choose, that's the key area for personal observation. We hope this deep dive gave you a much clearer, anatomically informed way to think about this very common challenge.